this with you?
Hey, it's Tyson. We just want to come in and talk to you today.
Great, man.
See if we could talk you into taking some tour of the place.
Let's get a tour.
Okay, let's go.
This is our consult room. Nice little area where we bring patients in and you know, a little more privacy so everybody can kind of sit down and relax. Our office, original office, was 8 treatment rooms. This one is actually 15 treatment rooms, so we almost doubled the size, which we love. So
would this be a standard treatment room that you'd have?
it really is. This is pretty much our standard treatment room, minus the Bud Light. But you know, it is our standard treatment room. These are some very interesting lights. It's all with ambient light, and it really kind of softens the room, but gives us plenty of light when we're working on patients. We've got large 42-inch monitors on the wall. We also have a TV that is right above the patient, so when we lay the patient back with wireless headphones, they're able to watch TV and not listen to the dental drill and that type of stuff. So it really is kind of a handy way of doing it. This is our sterilization area, where really everything happens between the 2 sides of the building. We've got 7 ops on one side, 8 ops on the other. In this room, you can actually see through the glass here. Those are 2 milling machines. So most of our crown and bridge work we're able to do in a single visit. We actually will put a block in that you know, we make a crown out of. These are what the blocks look like. This would be somebody who wants a white bleached tooth, or they bleach their teeth. This is put into this machine and it mills out a tooth. It's pretty amazing. We also then will put it in our oven and cook it, and it's all done within about a 45-minute to a 1-hour procedure.
So you're saying that a person can come in, you can prep and get everything ready for the tooth, that you can generate a crown,
Final crown,
all within an hour of the time that you've actually made the mold.
Absolutely, and it's done with such accuracy, better accuracy than you can do with an impression and sending it out. This is done with milling machines and an accurate optical impression. So when it's looking at it, it's an accurate impression. It's an exact impression. Pretty incredible technology. So yeah, we've got. I'll show you this.
So this is where you would sterilize your equipment?
We've got dual sterilization. We've got special little machines that can lubricate the hand pieces and sterilize those. All of it's done on every patient. I mean, we just bring it. This is our central location where we take care of all of that. So
right. Right in between both areas that you work.
Right. Well, let me show you the surgical area, and then
So you actually do you do anesthetized surgeries in this location?
We do. And you can walk in here and actually see the lights come on automatically. But this is really a sterile area where we can do surgeries. We do a lot of dental implants, a lot of implant surgery, what they call connective tissue grafting. We do a lot of different procedures in these rooms, and you know, we've got all of our monitoring equipment and everything else. So, and if the patient wants to watch TV, they can either watch it up on the big screen or watch it up on this also. We have 2 of these rooms, and we have a special waiting room for patients.
Oh, really? Okay.
We have patients that come from they'll come from 200 miles, and so if they're going to be here for 6 or 7 hours, they'll bring somebody with them to drive them, and so we want them to have a kind of a separate place to sit.
So as far away as 200 miles to Granbury?
We do. We have patients that come from Louisiana, Oklahoma, South Texas to do that type of stuff, because we have every piece of technology pretty much that's available in dentistry. We've got it, and if we don't, it probably hasn't been proven yet, and once it is, we'll have it.
And this is the waiting room?
This is our private little waiting room that we have. And so what we'll do is we'll bring a blanket in, somebody can sit in the chair, recliner, watch TV, and just kind of enjoy themselves while they're waiting on their loved one to have their work done. So,
well, this gets them out of the main lobby and gets them into a private setting.
And we'll give them a computer, and they can, you know, surf the net or do whatever they want to do as far as checking their emails or doing that.
Makes it really comfortable, and the lounge chairs look like you could take a nap if you needed to and just relax.
They won't let me go in there, let me tell you, because I'd be done for the day for right there. So, but let me show you the iCat technology that we have back in the back.
All right, let's go.
Coming back around to the main area, but this is what we call the iCat. It's an iCat Precise, which is a new technology. We actually got the very first one in the state of Texas. I think it was about 10 years ago. We just traded up to this model, which is a nice little x-ray machine that costs a couple $100,000. But for us, it makes sense because we do so many implants and so many surgeries. You can actually see on the x-rays, I mean, we can look at these x-rays in every dimension. We can change them. We can move what we're looking at. On, for instance, down here, we can kind of section the head in a lot of different ways and see everything that we could never see before. This is a three-dimensional picture of a three-dimensional object, which is wonderful. You know, much different than a two-dimensional picture or a one-dimensional picture of a three-dimensional.
So besides the surgical component of putting the implant and all the parts that go with it, this also helps you make those crowns and the finished product in the veneers and all the crowns?
This actually does more along the lines of orthodontic work and making appliances. We can also make surgical guides with this machine. Now, using this machine, we can pretty well do everything. There will be a time when the crowns will actually be made off of this machine. Once it's done, you'll scan with a radiograph. Today, with the optic impressions, it's actually very easy. So it's really, the technology is moving crazy.
Exactly. The layperson would just see the finished product.
Yeah.
But for you, you're looking at all of the ways to actually make that surgery as simple and as painless as possible.
Yeah, and we've been doing implants here for almost 30 years. So back before it was cool doing implants, we were doing implants. And the reason we were is because people needed them. And they're very successful, they work great, and it's something that, it's a lot better than going around with something you have to pull out of your mouth and stick in a jar.
Right,
Like
exactly.
that. So,
I remember that about my grandparents and
yeah.
parents. That was the appliance or
sure, whatever they were wearing.
Type of bridge or other kind of terms that I kind of remember.
Yeah.
This was a great tour, but it sounds like you have a party going on.
We do have a party.
We need to probably see
Take
what's happening
pictures
at
of
the
the
fish tank and
Yeah.
in the dinner table.
Yeah, that's
So
good.
let's go.
All right.